my screen. There we go. You guys see the second slide? Okay, good. All right, so the problem is the cure for many medical conditions are often drugs and surgery, and what we define as really sick care in today's environment. However, these methods often do not address or fix the root cause of our body's problem. The solution is REACT. So we're a proven, safer, simpler, non-invasive treatment that naturally fixes the root cause of physical dysfunction. We're an FDA-cleared medical device with an existing 510K. We actually have two 510Ks, and that's a license from the FDA that allows us to treat patients. It provides efficacy clearance for the physicians and clinicians that use us, as well as allows us to market our technology publicly in terms of the outcomes that we generate. We have more than 60 peer-reviewed published citations, and we currently treat over 10,000 patients each year, individual patients. So what is REACT? So we're the world's most advanced neuromuscular rehabilitation tool. So we stimulate muscle tissue up to 4 inches in depth with no skin contact. What happens is the brain is actually stimulated through a magnetic pulse that depolarizes the potassium sodium ions, and the muscle cell wall, and the muscles contract between 90 to 120 times a minute. As I mentioned, we've got over 60 clinical studies that back the science. So we've got two products. We have on our left here the REACT table. So this is an athletic training facility. The patient lies in the table. There's a wand under here that controls this magnet back and forth and up and down. And we can treat a variety of conditions, whether it's pain management, disuse atrophy, neuromuscular reeducation, increasing blood flow. And then the product on the right is our pelvic wave chair. So in the same vein for feminine health, although 30% of our patients are male on our chair, but we cure urinary incontinence through pelvic wave. So patients simply sit on the chair, we're able to stimulate the full pelvic floor, and it's the only device in the world that can stimulate pelvic floor muscle tissue up to 4 inches in depth. I'm proud to say in the last 18 months, we've cured over 700 patients of urinary incontinence, and this is a condition that affects over 50 million people in the United States. I've got a quick video I'm going to play for y'all. Exit out of this. I got it kind of pre-loaded here, and hopefully you guys can hear it. But it talks about the science and technology.
REACT is the gold standard for neuromuscular therapy. When REACT is activated, the bioelectric magnetic pulse depolarizes the potassium and sodium ions within the muscle cell wall. This in turn triggers a response from the motor cortex of the brain to fire or contract the muscle. This contraction is 100% involuntary from the patient's perspective. Stimulation can reach up to 4 inches in depth and requires no skin contact. The depth, rate, and location of the therapy is controlled by the trained operator of the REACT system. REACT, it is FDA cleared and requires no skin contact. Patients are treated with their clothes on. Visit reactinnovations.com for more details.
So hopefully you guys heard all that video. Okay, good. Yeah, so we're in several markets right now. So we're in physical therapy, athletic training, chiropractic, and we're moving into hospitals and OBGYN clinics here in 2020 and 2021. We've got a lot of large markets that we address. So we're currently treating patients in all of these areas. So wound care, spinal cord injury. We've recently won a number of awards for COVID recovery. So we're able to stimulate phrenic and thoracic nerves that control expiration of lungs. So we're working on patients in Michigan that have been ventilated from COVID. Do a lot of work with neuropathy patients, stroke, and there's a really huge market around medical aesthetics. Even though it's not really what we've applied our technology for, there's a toning and fat reduction component that's also as a result of using our technology. So used in all of these particular areas, but part of what we're doing over the next several years is developing new 510Ks in clinical research so that we become what we hope to be the standard of care within several of these particular markets, which are quite large. Here's some sample customers and pilots that we've run. So currently we're used over 1,000 times a day in 35 locations. We've got some key cornerstone clients in the NFL, the ACC, Big Ten, SEC, Premier League Soccer in Italy, and some great, amazing customers in traditional chiropractic, physical therapy, and so forth. So in the last 18 months, we've gone from 0 to over 1.2 million in revenue, and we've done this with just 2.5 employees. So a lot of great traction. We've developed over 2 million in purchase orders for 2020. Of course, I get my biggest PO in February of 2020 for 50 systems, and then COVID hit. So that put a big big crimp in terms of our overall path and progress, but it's a strong pipeline that's starting to pick back up. As I was talking to some folks before we got started, I just came back from Chicago, and we've got several new installations up in there this week. So our business model, we have traditionally been a model that is sold our equipment. So it's just been straight transactions. So we sell the equipment, we have a warranty, people use it, they use it for cash as well as insurance. So it works in both environments. Our product, which is going to be connected to the internet, that allows us to track more patient data, also allows us to do a little bit more sequencing with respect to our protocols. And the future for us is really about leasing the equipment rather than just selling it outright, because we are capped once we sell that piece of capital equipment. By leasing it, we get an ongoing recurring revenue model, and we're working through those right now. Some great testimonials, and this is a fraction of our folks, but you see Dr. Carroll, who's an orthopedic surgeon. He uses it both in pre and post-surgical environment for his patients. His ACL patients, we have now 2.5 months ahead of their normalized rehab schedule. Dr. Charlotte Buza, who runs women's health and pelvic floor rehabilitation for our biggest customer in Team Rehab. This has been a seminal product that's changed her path in terms of her career. John Kasich, who's the athletic director at South Carolina, they use it in the football department. And Dr. McGraw at McGraw Chiropractic just did a study with him. In 30 months that he's had React, he's a practitioner. He's generated an additional $175,000 in cash revenues from his practice in just 30 months. Our patients, our technology is life-changing. I was just up in Chicago, as I mentioned, doing a training with a pelvic wave chair in a clinic that has a React table, and I had 4 patients come to me as I walked, talking about how React has changed their life. These are people where traditional medicine has really given up on them. They want to do more surgeries. They want to load them up with pain medications. And we're able to, from a neuromuscular perspective, retrain and balance their brain and body to alleviate that pain, bring back the range of motion, bring back their strength and conditioning to allow them to have activities of daily living that are and improved from anything that they've had for years. So I'm pretty proud of that.
Just to give you a heads up, Ken, I'm sorry to interrupt. Yeah. We're a little bit over time, so if you're able to wrap up.
I'm done. I'm wrapped up. Yeah. So our goal is to really lead the advancement of physical and mental wellness with science, technology, ingenuity, and integrity. So that's what we do, and that's my contact information. So I forgot to scrub this. We are doing a capital raise. I know this is not a capital raise event, so I apologize for not removing that piece. But with that, I'll pause and see if you guys have any questions.
Awesome. Thank you, Ken. Yeah, so first off, awesome presentation. Thank you very much. It's very impressive how much traction you've been able to get. I think I heard you 18 months. Just a quick note, just going back to Ivory, I don't know if you're still on the line, but something that Ken did that really kind of helped me believe in this a little bit more is kind of, he talked about the traction, how many, how many different states and everything he's in. I don't know, so if you're able to maybe say something like sold over, I don't know, 100,000 whatever units or something in the past year or whatever, I think that'll help with your customers believing in your product. But yeah, so did I hear that right though, Ken? 18 months